Yes, sir.
Okay,
Yes.
okay. So in that case, so just a few general questions. Let me just ask you and get the feedback from you people. How would you want your ideal treating doctor to be? Can I get some answers?
Honest.
Honest, okay.
Communicative. Trust.
Trustworthy,
Communicative. Sir, he should be
sorry.
Sir, he should be compassionate and
Should be
understanding.
well
They got to be
dedicated.
compassionate. Very good.
Dedicated. He
Dedicated,
should be communicative. Dedicated.
dedicated. Okay, can I get the answers one by
should
one?
be well
Sneha
trained.
KM, can you answer please? Sneha KM, she is online.
Am I audible, sir?
Yes, you're audible. Continue.
Yeah. He must be the way he talks, the patient must feel free to tell their problems.
Okay,
And, he must be a good communicator and good listener.
okay. He must be a good communicator as well as a good listener. Very good. Tanisha Detta, how would you want your ideal medical teacher to be? Tanisha Detta is there? Ananya B. Maligi. Okay, this question is open. How would you want your medical teacher to be? See, we have a dual role. Working in a medical college, we would want to see the patients as well as teach the students. So, how would you want to see a doctor to be while treating the patients and while dealing with you students? How would you want your teacher to be?
Sir, strong work ethic as a
He must be
teacher.
communicative.
One by one, please. Can I have
So it should be knowledgeable and upgrade, sir.
knowledgeable, up to date?
And
Okay,
yes, sir.
Sir, strong work ethic
strong work ethics. Great.
teacher.
He should be communicative, sir.
He should be a good communicator. Yes.
Teacher should be dedicated to share their knowledge.
Teacher should be dedicated to share the knowledge. Yes, I do agree.
Sir, he should clear every small doubt the student has.
Pardon?
He should clear every little doubt the student has.
Okay, he should be able to clear every doubt the student gets. That means to say he should be competent.
Yes.
Okay,
Sir, he
competent
should
in
be
teaching
able
as
to
well.
enable us to analyze things properly.
Pardon?
Sir, he should be able to help us to analyze things properly.
Okay, he should be able to make you analyze the things properly. Can I get your name, please?
Sir, Prachi.
Sorry.
Prachi.
Okay, 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 okay.
Sir, he should not
Okay,
discriminate among the students.
he should
He
not
should be a good
discriminate
advisor,
among
sir.
the students. Yes, great. That none of us do.
He should be a great advisor, sir.
He should be
Advisor, great advisor.
a great advisor. Okay, you would. We have a mentorship program in our college, so you need not have to worry for that.
Yes,
And
sir.
then, and now, how
Sir,
would
he
you
should be
want
well
your?
prepared.
Yeah, yeah. Please continue.
They must be well prepared as
They
well
must be
before
well
teaching
prepared.
anything.
Yeah, most of the
They
doctors do will be prepared. And now, how do you want your ideal doctor to behave in his daily pursuits with the society? See, with the patients, with the students, and in my personal life, how should I behave with the society or the public? How would you want me to behave with the public?
Sir, the cherry picking of the patients should be avoided.
Sorry.
The cherry
picking of patients should be avoided.
Okay, cherry picking of the patient should be avoided. Good.
Sir, a doctor should be humble.
He should be a humble person. Yes.
Down to earth and grounded.
Down to earth and grounded. Okay.
Sir, a doctor should not be proud of himself.
He should not be proud of himself. Okay.
He should work keeping his emotions aside.
He should work keeping his emotions aside. Okay.
Sir, he should not misuse the public funds.
Not misuse the public funds. Okay, if he is into government service. Okay,
Yeah.
fine. Yeah.
He should not betray the society or community. He should be loyal.
He should be loyal to the society or the community. Yes.
He should not.
He should be.
Sir, he should not be aggressive and not use false words, abusive words.
He should not use foul words. Okay, I do agree. Okay, thank you for your feedback, whatever you have given. So now just remember whatever you have told. Let us just look into it. How much is it practically possible to implement in your practice? And if in case you are practicing that, what hitches you would come across? Okay. So the outline of my presentation is going to be, I'll be dealing with what is professionalism firstly and what constitutes professionalism. And then in famous conduct, it was dealt by Dr. Sridhar, who is my colleague. And I'll be touching upon medical negligence, so that you will be aware about negligence, what does it mean, what are the implications of negligence, and what would be the consequences, and what is it about. Okay. So starting with, which kind of a doctor would you want to get treated as a patient? Choose one among these. One on the left, who is over enthusiastic, young, hot-blooded, yo-yo style, a jeans, t-shirt, an apron, a stethoscope just hanging around like the earphones. But he's full of knowledge, updated, recent knowledge. And the other one, who is, you can make out, right? In his attire, based on the attire, which doctor would you want to choose? The one on the first left or on the right? Am I audible?
On the right, sir.
One on the right. Why?
Professional, sir.
Why? Why? Why?
On the right.
Just the dress made so much of difference. Right, right. I agree with that. Okay, but just the attire or the dress made so much of difference, is it? My question is, does your
What you
dress,
wear is what you are. So sometimes it won't make a difference.
sometimes it is going to make a difference? You mean to say that? Is it? Let me just give you a small example. Can you please recall this scene from any of, or whom do you identify these women to be as?
Hockey players and
Hockey
football
players.
Hockey players, where in
players
Indian hockey
Japan.
players? Indian hockey players? Indian team, Indian national team.
In the movie, sir.
Movie.
In the movie, which movie was that?
Chak
Chak De.
India.
Okay. So each of these were representing from different states. That is what they told in the movie in the beginning, right? That means to say they were good in their skills. They were the chosen ones. But they didn't win the initial series or the initial matches. Why? What was the reason?
There was no unity.
There was no unity. Good.
No coordination in
So
the team.
different
No
background.
coordination. Yes. Did they have
Ego.
mutual trust?
No.
No, sir.
No, sir.
Did they have any kind of altruism?
No, sir.
No, sir.
Altruism,
No,
compassion,
sir.
all these things were dealt by Dr. Shubha and Dr. Sudhindra yesterday, I think. Dr. Nalina madam also, she spoke very well. Did they have it in the beginning?
No, sir.
No.
Sir.
Later, once they developed all these, the desired characteristics, what we were speaking of, they formed what is called a team, isn't it? So, what was the outcome of the
Yes, sir.
team? In a team, what happened? When they started playing as a team, they were honest, they were open with each other, there was altruism, there was compassion among everyone. So, what was the outcome?
Victory, sir.
Victory, right? Yes or no?
Yes, sir.
Yes, sir.
Same thing applies to medical profession as well. It is no way different from what we saw in that movie. Henna? Yes or no?
Yes, sir.
Yes, sir.
Yes, sir.
Yes. Okay. So, did you understand what I wanted to convey was in simple terms? I have put it to you in this way. Is it clear?
Yes, sir.
Okay. So, medical professionalism, see, if you consider, you are able to see this slide. Is the slide visible?
Yes, sir.
Yes, sir.
Yes, sir.
Yes. Okay. So, the building what you see is your career. Okay. The foundation of which is going to be your clinical competence, your skills. On that you have communication skills, legal and ethical understanding. These form the foundation of your career. So, what are the foundation blocks of your career? Clinical competence, clinical skills, and communication skills, and legal and ethical understanding. Is that fine? And the walls of your, or the pillars of your buildings are excellence in your field, humanity, accountability, and altruism. These are the 4 pillars of your building. What is altruism?
Going
Selfless
after
care.
your
Selfless
humanity.
service. So once you have all these, that is going to support what is called as the roof of your building, that is professionalism. Is that clear?
Yes, sir.
Yes, sir.
Altruism, whatever you do is in the best interest of the patient, you got to be doing it. That is about altruism. Now going for accountability. So whatever things you do, whatever treatment you give, or whatever modality of treatment options you would give, that should be accountable. Whatever you do, the treatment you give, the service you provide, it should be accountable to individuals, to the patients, to the society, to the organization in which you are working. So that means to say you got to be taking up the liability, and you have the accountability to answer any of the questions to the higher ups, higher authorities. Then excellence, that means to say you got to be the best, have excellence in such a way that yesterday it was Vivekananda Swami Jayanti, right? National Youth Day. So what did Swami Vivekananda ji say? If you are going to be a cobbler, be the best cobbler in the field such that the king comes to you. The same way we say, whatever specialization you would want to take up or do, be the best, be the pioneer, be on the top. That is achieving excellence. Is that clear? And then we have duty. Sorry? And duty. You got to be like, the moment you are into medical profession, it is assumed that you are duty bound 24/7. That is what Dr. Nalina was saying, right? You cannot say my duty shift is over, my duty ends at 5 o'clock and I leave at 5:30, and I'll not be seeing any patients after 5:30 or so. You can't be doing that. You got to be available 24/7. If not, you got to have an alternate arrangement made. That is duty. And coming to honor and integrity, you got to have the highest standards of behavior, and you should not violate one's personal or professional codes. Got it?
Yes, sir.
Am I too fast? Or everything is going above your heads? Is that so?
No,
No,
sir.
No?
No, sir, we
Okay.
can understand, sir.
No,
We
sir.
can understand,
Okay,
sir.
fine. So next is, you got to have respect for each other. That means to say, it could be your patients, their families, other physicians, your professional colleagues, such as the nurses, the paramedics, the medical students, the residents, subspecialty fellows. And that is what is the essence of humanity, not just medical ethics. It is about humanity as a person, how you got to behave, isn't it? So in a nutshell, from all these days, from probably last 7 or 8 days, this is what you were dealing with. Everything was put up like this. Heap of things what you got to be knowing. Each of this, when you come into your contact classes, each of this is going to be segregated one by one, and you will be learning it one by one. And you got to practice this right from day one of your career. It is not like you will achieve or get this once you finish your MBBS. You got to start developing these characteristics or these behaviors now on itself. Is that fine?
Yes, sir.
Yes,
Yes,
sir.
sir.
Okay. So as a professional, what are your commitments that you got to have? You got to have commitment of professional competence, isn't it? To be updated with scientific knowledge. You got to be honest. You got to maintain patients' confidentiality. Maintain appropriate relationships. You got to have quality of care which is always increasing. Improve the access to healthcare. These are the commitments what you are going to have as a doctor. Is that clear?
Yes, sir.
Yes, sir.
Okay. So this is about professionalism, which I have just touched upon and told you. If you've got any queries related to this, you can ask me. Any queries? Tanisha Deta? Arun B? Chetana Ji?
Yes, sir.
Yeah, you've got any queries?
No, sir.
No, you don't have any queries. Deepa, yes?
Yes, sir.
Okay. GS Rahul?
No, sir, no queries from my side.
No queries from your side. Did you understand?
Yes, sir, I've understood.
Bit of it, whole of it.
No, sir, I understood everything, sir.
You understood everything. Good. So can we move on to the next topic?
Yes,
Yes,
sir.
sir.
Yes, sir.
Okay. Coming to medical negligence per se. So till now we were speaking about misconduct, and now let's speak about negligence. So till now you had the concept, you were being told like, be proud or don't be proud. That is what you were telling. But how many of you are not proud being a doctor? Tell me honestly. Are you not proud that you are going to be a doctor?
Yeah, sir.
You are
Yes,
proud,
sir.
right? But you were told not to be proud, isn't it?
The pride should be in a limit.
In a limit.
It should,
So can you just
it should,
quantify the limit and say?
it should not go above our heads as like we should not feel like we are all knowing, or we should not feel like we are the highest.
Okay, okay.
Yeah,
And in the beginning of the session, somebody was saying you got to be very humble, you got to be down to earth, you got to be grounded.
you should
Now,
have
Sir,
the strength
overconfidence shouldn't
every day.
mask proud, sir.
sorry?
Overconfidence shouldn't mask our pride.
Okay, overconfidence shouldn't be there. Okay,
So there should be respect for autonomy, and you should welcome ideas in the profession. You can't be like
okay,
you
you
can't be
got to
headstrong.
welcome ideas. Now I will say, till now I spoke as Chandan V, Forensic Medicine, Associate Professor, MBBS, MD. Okay, now I would reveal it is Dr. Chandan V, MBBS, MD, LLB. Okay, I'm playing a triple role, not just dual role. Now as a medical negligence specialist, okay, as a lawyer who deals with medical negligence cases. So till the patients come to you, get the treatment, they'll be very much humble. They'll be listening to you, whatever you say, they'll be agreeing for everything. Okay. Once the scenario changes, they would the concept of Vaidyo Narayano Hari is gone. Odi, Badi, Kadi, Hari is only the concept which will be remaining at the last if something goes wrong. Am I right or wrong?
Yes, sir.
Yes, sir.
Yes,
Right.
sir.
So, if
Yes,
you
sir.
are humble in that situation, grounded and very much down to earth in that situation, what is going to happen? From the ground, you will be buried straight away down. Am I right or wrong?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Now, you are free to disagree with me. The whole concept of telling you about this medical negligence is all these days, what has been taught to you, I'm not negating it, but I'm just preparing you for the current scenario what we have in our country. Don't you see the things like very recently also we had clashes between the doctors and patients coming up in newspapers and all, right? Have you seen it or not?
Yes,
Yes,
sir.
sir.
Yes,
Can
sir.
continue.
Yes,
Doctor
sir.
being sued for negligence. Last year in Bangalore Medical College, there was a strike as well, isn't it?
Yes.
Okay, anyways, let me get into the topic medical negligence, also called as medical malpractice. So, what does it mean? Negligence. Just look into this slide. What do you make of that? Doctor is going to do a spinal tap for the patient. He is prepared, but he is half prepared. He doesn't have the vial to collect the CSF fluid. Instead, what he does, he goes in search of the vial and places his coffee cup. Can you see here? Is that negligence? Misconduct? Isn't it negligence?
Yes, sir.
Yes, sir.
Yes,
Yes,
sir.
sir.
So, what does negligence mean?
Yes, sir.
In simple terms, it means you are omitting something. You are not doing something which a reasonable person would have done it. That is one part of the story of negligence. The second part is commission of something. That means you are doing something which you are not supposed to do. Is the concept clear? So what is negligence? It has two components, acts of commission and acts of omission. Doing something which is not to be done, or not doing something which is absolutely necessary to be done. So that constitutes negligence. Okay. So if there is negligence in India, that comes under Consumer Protection Act, or also called as COPRA 1994 Act. Is that clear? So according to that, medical negligence is lack of reasonable care and skill, or willful negligence on the part of medical practitioner in the treatment of the patient, whereby the health or life of the patient is endangered. Is that clear?
Yes, sir.
Yes, sir.
Read it once again.
Yes. Yes, sir.
Yes, sir.
It is lack of reasonable care and skill, and there is willful negligence, because of which the patient suffers harm or sometimes even loses his life. That is termed as medical negligence. Lack of reasonable care and skill. Am I clear?
Yes,
Yes,
sir.
sir.
Yes,
Okay. So now going into the types of negligence, we have two types of negligence. We divide them into as civil negligence and criminal negligence. I'll give you examples so that you will understand what is civil negligence and what is criminal negligence better. Okay. So let us see here. Civil negligence. I'll just give you a small example. See into the picture. What do you find here? Doctor has put his wife's spectacles in a hurry and he is not able to differentiate the site of injection. This is grossly given actually, and instead of giving the injection elsewhere, it is given on some other site. The picture is showing that. It is just to make you understand. Is it gross negligence? Is it endangering the life of the individual? No, right?
No.
Is it violating any rights or any law?
No, sir.
No. So that means to say a civil negligence has no specific or clear violation of the law. Okay? It is simple absence of reasonable care and skill. And if at all this comes to be, or there is a litigation on this, or a case is filed, the case is going to be, the trial is going to be held in consumer courts or in a civil court. Clear? And the punishment will be in terms of giving compensation, which is called as damages. Is the concept clear? There is no violation of law, there is just absence of reasonable care and skill. The trial is going to be held in consumer forum or the civil court, and the punishment is paying fine. That is civil negligence. Examples: failure to give anti-tetanus toxoid. A person who has come with injury, he has fallen from bike and there is bleeding all over, and you miss out giving a shot of anti-tetanus toxoid. So that is, you are omitting to give something which you are supposed to give. So is it a negligence? Act of omission. It is civil negligence. Failure to take X-ray in cases of injury. Just like what I told you, a person has fallen from his two-wheeler and he has sustained open injuries. Should you not suspect any fractures? Should you not look for it? You got to. And if you fail to take X-ray in such cases, it is civil negligence. And refusing to admit the patient requiring urgent hospitalization. Failure to obtain informed consent. Failure to attend the patient on time is also negligence. That is civil negligence. What is the punishment for that? What would be the punishment? We just spoke. Penalty. Failure or delay in diagnosis. It is also a civil negligence. Premature discharge of the patient. The patient has met with an accident, he has a fracture, he has to be admitted, he has been operated, he wants to be hospitalized for minimum of about 5 to 7 days, but he is discharged within a day or two. So that amounts to premature discharge of the patient. Even that is civil negligence. We have few cases here. Probably I will be mailing you this PPTs, so where you can play and see each of the cases there. Is that clear? Is that okay?
Yes, sir. Yes, sir.
That will just save time. In the evening hours, you can just go through these links. Okay? So coming to criminal negligence, civil negligence, there was no violation of the law as such, but here there is violation of the law. Okay? There was loss or lack of, there was very minor loss of or lack of reasonable care, but here there is gross negligence or lack of competency shown by the doctor. The trial is at criminal court. Punishment is fine, imprisonment, or sometimes even both. The damage done is irreparable, or sometimes it could be ending up in fatality as well. So it is booked under section 304A of IPC, that is rash and negligent act amounting to death. So now, in the beginning you were saying you got to be robust, you got to have animal instincts. I just forgot who told me that. When you have these laws and something goes wrong while you are treating a patient, will you go to do any such things over enthusiastically? In the morning session I had an answer, which was something like you got to be very robust. Can you be doing that? Calculated risk is to be taken. It is not like you know something and you straight away jump into it. No, you cannot be doing that. So examples of criminal negligence, let us give it gross, whereas there is gross absence of care and skill. Amputation of wrong finger. The individual is supposed to ampute a gangrenous left finger. Instead, he cuts the great toe of the right foot. Isn't it gross negligence?
Yes, sir.
Absolutely.
Yes. Operating on a wrong person, wrong patient. Supposing there are 4 or 5 OT tables, and let us assume there are 4 or 5 patients. There is one girl who is about 18 to 20 years old who has come with appendicitis and she wants to get appendicectomy done. And table number 2, there is a female about 32 to 34 years who wants to get, she has completed her family, she wants sterilization, that is tubectomy to be done. And the doctors in the OT, though you find all of them wearing green color gowns, green color uniforms. So the doctor confuses. He gets confused. He goes and does the operation which is supposed to be done on table 2 in table 1, and table 1 is the reciprocal. So appendicitis is done on patient 2, and sterilization is done in a girl who is not yet married. Is it gross or criminal negligence or not?
It is.
It is, sir.
Yes, yes, it is. Okay. Accidentally or willfully leaving any instruments or any of the sponges or any materials, mops which you use during your surgical operation, if it is left behind in the abdomen or any of the body cavity, even that amounts to criminal negligence. Leaving tourniquets for too long hours, mismatched blood transfusion or giving infected blood, performing criminal abortion, operating under the influence of alcohol or narcotic drugs. All these are considered to be as criminal negligence. Am I clear? Are the examples
Yes, sir.
clear?
Yes, sir.
Yes,
Yes,
sir.
sir.
So these are the examples of the photographs where we can show you the negligence of the doctor. In the first photograph, we can see, as of now, you can consider them to be as just scissors. Those are artery forceps which are left inside the abdominal cavity. Here, the scalpel blade, the dissection blade what you have, that has broken and that has been left in the thoracic cavity. The second image. And in the third image, very faintly you can see, so the cloth is not radio opaque, but you can find the soft images of a sponge which is retained in the abdominal cavity. Can you see? Is it
Yes,
visible?
sir.
Yes, sir.
Yes, sir.
All these amount
Yes, sir.
to, all these amount to criminal negligence. Okay? So the cases are also given here. Am I clear with the concept of criminal negligence?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So what are the precautions that we got to take so as to prevent these negligences? You got to have a good rapport with the patient. One, use all available and relevant information in the treatment of the patient. Maintain accurate and complete medical records. Obtain informed consent. Do not criticize any of your colleagues in front of your patients. Keep an attitude of care and concern towards your patient and be updated with your knowledge always. Is that clear? Am I clear?
Yes, sir.
So this is about negligence. Just in brief,
Yes,
in
sir.
detail, we'll be dealing when you come into our contact classes or when you come into third phase of MBBS. Okay, we have just touched upon the cases or the types of negligences and what could be the outcome of that. Any queries regarding this?
No, sir.
No, sir.
No?
No, sir.
No, sir.
Okay. Deepa S, any queries?
No, sir.
Pushwant Somaya, you're there?
Yes, sir.
Any doubts?
No, sir.
Manogna, yes. Manogna, yes.
No queries. Yes, sir. Yes.
Pankaj Sirvi,
Yes, sir. No query, sir.
Sakshi SR,
Yes, sir. I have no queries.
Sharmila E,
Yes, sir. No
Mohammad
queries.
Omar. Mohammad Omar, any doubts? Mohammad Omar is not there.
Sir, I'm there.
You're there. Any queries?
Yeah. No, not at all.
No queries. Tarun Kumar Hallur.
Yes, sir.
Queries?
No, sir. No queries.
Vasant NS. Vasant NS. Is not there? Okay. Thank you. Thank you for your patience.
Sir, I had a doubt.
Yes, please. Can I know
So
your name?
yesterday I asked, sir, my
Ah,
name is Gaurav.
you are Gaurav. Yes?
Sir, I had asked ma'am a doubt yesterday regarding this Consumer Protection Act because
Yes?
previously she had told that it recently with the changes it doesn't come under a business service but comes business oriented but comes under service oriented the profession. So it cannot particularly come under Consumer Act. But now how is medical negligence and all cases dealt with the medico legal team? Are they
See,
with the Consumer Protection Act or
with
is
the
it
see
separately?
the see the thing is, the doctor takes consultation fees and he renders his service. So there the doctor is a person who is giving his service and the patient is a consumer who is taking service. So they brought the medical profession also under consumerism. So it is still under Consumer Protection Act. It is only the High Court of Mumbai or High Court of Maharashtra in one particular case told that doctors can be exempted from such cases, that to for civil cases let there be no FIRs lodged. But the Supreme Court still says if there is gross negligence, that means to say criminal negligence, still we are under the ambit of Consumer Protection Act. We are not completely excluded from COPRA. But the government doctors do not come under the limit of COPRA because they do not charge anything. Therefore, the service whatever they are giving is for free from the side of the government. Therefore, they do not come under the purview of Consumer Protection Act. But whereas any private practitioner for that purpose, he is under the obligation of Consumer Protection Act. Blank.
Okay, thank you.
Yeah.
Sir,
It
I
was
have a doubt.
yes.
Who is responsible for giving the proof of criminal negligence, like in the case you told, leaving behind sponges or scalpels inside the patient?
Yes,
Is it
good thing.
possible
What
to
you have told is good thing. So if there is, I gave you there was a slide which was showing you radiographs, skiagrams, wherein it was showing an scissor being left in the abdomen. Okay. So there the patient or the aggrieved party need not prove that the doctor was negligent. Thing or the fact speaks for itself. So there is one dictum when you come into second year or third year, we will deal in detail, that is called as re ipsa loquitur.
okay?
Okay, there is a term. This being an introductory part, we have just touched upon the things. Okay,
Okay, sir.
so the burden of proof in a case of criminal negligence need not be lying completely on the accused himself. Okay,
Okay, sir. What if the radiologist lies about it, like to support the surgeon or the
how
medical
can he lie? How
superintendent?
can the films lie?
What if he hides the films or something?
That will not be done. He got to be disclosing it, right? That
Okay,
will
sir.
not be done usually. The consultant doctor or the surgeon will be called upon and he'll be told, see, this has been done. So a rectification has to be done. A second operation will be done and immediately that will be rectified.
Okay,
See, at such times, what being a doctor, you got to be honest, accept that some mistake has happened and immediately correct it. So you will be safe, right? Instead of hiding it and the patient going in for further complications and losing his life, what is better?
Being honest.
Being honest, tell it, and save the life, isn't it?
Yes, sir.
Yeah. There comes
Thank you.
the core values of a physician, what it was discussed, that is coming into picture there.
Yeah.
Being honest. Okay?
Thank
Yeah,
you,
any
sir.
other queries?
Hello, sir.
Yes, please.
Yeah, my name is Meghna, and
You are
so
Meghana.
yeah, so what would be the punishment if the doctor reveals the sex of a baby, or he files false reports,
See, revealing the sex of the baby, that we have separate acts and legislations for that. It comes under PCPNDT Act, Prenatal Conception and Prenatal Diagnostic Techniques Act. So according to that, it will be punished. As of now, don't worry. Once you come into the core subjects as such, you will be dealing with that one by one. Okay?
Okay,
Yeah.
sir.
There is a law for that. That is, as of now, just remember PCPNDT Act.
Okay, sir.
Yeah. No queries? Yes, sir, please.
So Chandan sir, I am asking you a question on behalf of students.
Sir.
We have listened to all lectures and discussions about ethics and professionalism, malpractice, and core values and all that. Why does it matter ultimately that anybody should be moral or anybody should be ethical? Why bother?
I didn't get.
Why bother being ethical or moral? How does it matter?
Being moral or ethical is where like a doctor is expected to be. It is the core value of a doctor.
Yeah, that's fine, absolutely fine. It is expected.
Yeah.
Everybody expects. But where do we get those morals or ideals, and how do we become moral? Why should we be moral, and how do we become moral?
See, as I could say, sir, like I have been following my teachers. I have been looking into them, and I have inculcated all these the idealistic moral or ethical behaviors by seeing into my seniors, my peers, and then I have developed this. And the same thing is expected from the students as well. The question as to why should we be ethical, that question becomes a bit difficult.
Yeah, it's a philosophical question.
Philosophical question.
And
that is what
the underpinning principles, the topic, concepts of professionalism and ethics. We need to have some discussion on why it matters to be ethical. Is it just about getting punished by doing something wrong by law, or are there some lines that go just under the radar of the law but are still unethical? And in those cases, why be ethical? Why does it matter? Or if it matters, where do we get these ethical principles and ethical values from? What is the philosophical reasoning behind this?
Sir, I would find it difficult to answer this as such, but
if you don't mind me adding,
yes, sir, please.
I'm just going to give some general description of this moral philosophy.
Yes, sir. Yes.
Idea called moral philosophy. There are very famous philosophers beginning from Aristotle and Socrates. The Socratic method deals with these kinds of questions, and he asks many questions to his audience, or he frames these questions, very difficult questions. For example, I would like to introduce our students to quite a difficult question, and let's see how many of them actually uh, come up with with an answer. Are you all students listening? Guys?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
Yes,
Okay.
sir.
Yeah.
Great. So imagine you are the driver of a
This is the famous trolley case.
trolley car.
Trolley car.
So
case.
you are actually sitting in the driver's seat of a trolley car, and you lose complete control of the trolley car. Trolley in the sense, on the railway track there is a trolley that is going, and you are sitting there, and it has one steering wheel. Apart from that, there are no brakes. No brakes are not working. Nothing is working, and on that railway track or the tracks, you see there are 5 people working, and you can't do anything. Only the steering is working. You can move the steering and turn it. If you turn it, there is another track, side track. You can turn the car to that side track, and on the side track you see another one person standing and working. And if you don't turn the steering, the trolley car will run over 5 people, and it will kill all of them instantly. And if you do turn the steering wheel, it will run over one person on the side track, and it will kill him. What would you do? If you are the driver of the trolley car, what would be your action?
Go straight and kill 5, or take a deviation and move on to the side track and kill 1.
Kill 1,
You
and
have only 2
in,
options.
in that action, by killing 1, you are saving 4. Or if you
5.
don't turn the steering wheel, you are going to kill 5. So go straight and kill, let all the 5 people die, or turn the steering and kill 1 person and save 4 people.
What would you do?
Go ahead. One by one. Say, what will you do? Anjali, what would you do? Can't hear you, Anjali. Anjali, can you come again?
Sir, I will turn the trolley.
You will turn the trolley.
One person.
Okay.
One person.
How many of you agree with her? Just say yes.
Yes,
Yes, sir.
Sir.
Yes, sir.
Yes, sir. Yes, sir.
Okay. How many of you disagree with her decision to turn the steering? Say no.
Sir, no,
No, sir.
No. Okay. So who told no? Can I have the names, please?
sir. Harsha Vardhan.
It's okay, fine.
Sorry?
Harsha says as you can see, I mean, the vast majority would want to turn the steering and go on to the side track where 1 person gets killed and 4 people would be saved. Ultimately, the numbers matter. That's what the principle that you are coming out with. Yeah.
Excuse me, sir.
Yeah. Go ahead. Hitashri, yeah, go ahead, please.
Excuse me. Sir,
Yeah.
if it is a trolley car and it is traveling on a train track, why can't we crash the trolley car before it hits either of the 2 people, sir?
You don't have any controls. All that you have
Brakes
is
are
one
gone.
steering wheel. Nothing else is working. You don't have brakes. You don't have any other way of stopping the trolley car. That is the problem. That's a question. It's a hypothetical question. It is not a real scenario. I'm trying to make you think.
Sir, can I answer?
Yeah, please go ahead.
Sir, that one person in the other track was sure that the trolley car will not come to his track, and he was careful.
No, there is nothing like that. They are unaware, oblivious to your thing. They are basically in a tunnel, let's say, and they can't see a train coming or a trolley car coming towards them, and they are completely oblivious to the trolley car, and the trolley car person only knows that yeah, there are 5 people. He can see there are 5 people on one track and there is one person on the other track. The people working on the tracks have no clue, and the trolley car is moving very fast, and the person who is sitting with you as a driver should make a split second decision, and majority of you decided that you are going to turn the steering and go on to the uh, track which had only one person working. Now there is a twist. Imagine you are an onlooker, you are not the actual driver. Okay, the trolley car is actually moving, and you notice that it has probably lost control, and there is no one sitting in the driver's seat, and you are standing on the side of the track, and there is a small bridge over there, and you see a fat person leaning over and looking at that trolley car, and if you just give him a small push, he would fall onto the tracks, and he is so fat that he can stop the trolley car from moving forward. Okay, the scenario is same. There are 5 people on one track, there is one person on the other track, and you can actually stop the car or the trolley by pushing the fat person who is standing on the bridge, which is just over the tracks. How many of you would say like you would go ahead and push that fat person onto the tracks and stop the trolley car from moving forward and killing the 5 people? You don't have any other control. You don't have a way to change the lane. There is nobody sitting in the trolley car. They have no control. Nobody has control. Only way you can save those 5 people working on the track, which are they're all healthy working, healthy people, young people, and there is one fat person on the bridge, and if you push him, he will fall on the track and he will stop the trolley car. How many of you would push him? Those of you who said,
He'll lose his life, sir.
yeah, he will die. Instantly he will die falling on the track, and the trolley car will hit him and it will stop. That is the scenario, that is the case. How many of you, whoever said they will turn the steering wheel in the earlier case, would now be willing to push this fat man onto the track? Say yes. Whoever wants to push the fat man, say yes. No one? How many of you would not push? Say no.
No, sir.
No, sir.
No, sir. No, sir.
What changed between the two scenarios? See, in the first case, you turned the steering wheel and killed one person and saved 4 people. In the second scenario, the numbers are same. You pushed one person to save 5 people. Ultimately, 4 people would be saved, one person would be dead. What has changed in these two scenarios? Tell me. Why do you think it is not acceptable for you to push over a person over the bridge and let him be killed by the trolley car, and in the first scenario, turn the steering wheel and let the car run over one person who was also healthy and was working on the track? What has changed?
Sir, I think in the first case, it's in your control and you are responsible for it, whether you kill 5 people or one person. But in the second case, it's not your, I mean, you're just the onlooker, and killing one person would be like you'll have a case against you, maybe. And I think it's the 5 people's responsibility to be aware of what's going on around them.
No, they are not aware. They have no way of knowing that there is a trolley car coming and hitting them.
Sir,
It's
in
a
the first
hypothetical
case,
situation.
killing was inevitable and it had to happen from your hands only.
So since it was inevitable, we are going for smaller numbers. But killing is killing, and it will happen in your hands only. But in the second case, there is this. Uh, what is happening is not under your control, and killing is optional. From your side, killing is optional,
Deliberate.
which is why people choose
And
on
if you
sex
don't do
as
that,
personal way
there will be
from
five
their
people
place.
killed. If you don't push that fat person, five people get killed. So that is, you can stop it. It is in your hands to stop that. Yeah, but you still can stop it. Are you morally bound to stop that from happening? Why is it more? Why is it immoral to push one person or a fat person onto the tracks while just turning the steering wheel to the side track was morally acceptable? How do you come to this conclusion? Where do this? What see? What I'm trying to get at is there are two principles at play here. There is something called as utilitarianism. So ultimately, many of your judgments, ethical, moral judgments, they arise from a concept called understanding the consequences of your action. So you look at a problem and you try to analyze that problem and try to see what would happen if whatever choices you make, you think about it and you see, analyze what would happen, and you base your decision based on the consequences that are going to happen because of your action or non-action. So it's also called consequentialism or utilitarianism. Uh, there's a famous English philosopher in the 18th century uh, who actually proposed this, who gave a proper description of utilitarianism. You can go ahead and search utilitarianism in YouTube or in Wikipedia, and you'll get a very good idea. His name is called Jeremy Bentham. He was a English philosopher, and opposed to that, in the second scenario, you people probably thought it is immoral, no matter what the condition, how many people lives are being saved. Imagine it is not five people. It is a nuclear bomb, and you could stop the bomb from exploding by killing one person, and if you don't kill that person, the nuclear bomb would explode and it would kill a complete, I mean, it would completely obliterate a city of 10 million people. Would you kill that person to save 10 million people? What if the stakes were high? Are there some categorical moral standards or moral principles which prevent you from doing something, no matter what the consequences are? Something is wrong because it is wrong. Are there something like that? In the second principle, second instance, that is what most of you probably came to a conclusion. Like, pushing a person by your hand is tantamount to murder. So in that case, it is wrong no matter how many lives it is going to save. So this kind of moral reasoning is called categorical moral reasoning. John Stuart Mill is an English philosopher who propounded this theory, and these have been debated over long periods of time, from the time of Aristotle and Socrates, and even now we have discussions going on between one school of thought who think morals are dictated by God, and there are others who are basically from the scientific field and evolutionary biology and evolutionary psychology, who show that it is not true that the morals or principles come from any divine sanction. They are ingrained in us because we are human beings and we evolved from our ancestors, and there is a long process
nearly 3.5 billion years of process which has made certain neural connections to be much more stronger and much more effective, and it has enabled a cognitive function which is called reasoning and foresight, due to which you are able to think like this. I showed you two examples of two different types of philosophies emerging just because of a simple change in the scenario, right? These principles, you had never thought about this till today, except if you're a philosopher, or if you have a philosopher parent, you have never been introduced to these kinds of subjects earlier, and now you thought about it and you instinctively formulated a principle of moral science or ethics just out of your brain. And how is that possible that your brain is capable of doing this? That is one of the ideas, or that is what the evidence that is being cited by biologists and evolutionary psychologists. On the other hand, we have theologians who think every moral principle is born out of the dictates of a god. Uh, so, which I completely disagree with. That is up to, there are good ways and bad ways of reasoning moral philosophy, but when you look at this, if you go back and see the utilitarian principle and the categorical principle, you will understand how to think about a certain issue. When you're confronted with a moral dilemma, an ethical issue, you have to reason, use your uh, reasoning power, use your foresight, and understand the consequences of your action, or some things may be categorically wrong because of the nature of the action that is. Uh, so, when you're confronted with any dilemma, what you should do is ask yourself, I can do this, but should I do it, or ought I do it? Should I be doing something? So the answer you come up with depends on the utilitarian principle or the categorical principle. So think like this in a logical way and educate yourself. Go ahead. I can tell you there is a beautiful lecture series called Justice by Richard Sandel, who is a Harvard professor. The Harvard University has actually shared that they have recorded his entire philosophy course of 40 lectures, and they have uploaded it onto YouTube. If you want to understand, if you want to be exposed to very deep philosophical reasoning and how to think about these important questions, you can go ahead and search for that series or playlist on YouTube. No, it's not Richard Sandel. It is Michael Sandel. Sorry, Michael Sandel. That's a professor's name. It's a Harvard University course of philosophy, political philosophy. It's a wonderful philosophy course. I have been enriched by that. I suppose you also will enjoy that. Take your time. You have entire 4.5 years or 5 years. Watch it whenever you get time, or you can watch it now, since there are no other assignments or classes for you. This must be the right time for you to go ahead and watch those kinds of videos and enlighten yourself. Any questions?
No,
Any
sir.
questions for Dr. Yogesh and Dr. Chandan? So, does this idea of moral philosophy intrigue you enough?
Yes.
Great.
Yes, sir.
So, let's hope you all
educate yourself. There is a element of self-directed learning involved in this. So please do, because we do not have medical humanities as a subject. It should be this part of education, mainly the moral philosophy side, should be done from your end. So I have just directed you, I have shown you the path. Please go ahead and learn about these things, and hope to see you soon in the college. Have a nice day ahead. In the afternoon, you can come back at 2 o'clock for the afternoon sessions. Now, please provide the feedback.
Thanks a
And
lot.
yeah, and you can log out.
I just have a small announcement to make. Is everybody available?
Thank you, sir.
Yeah, almost.
Is everybody available?
Yes, sir.
Yes.
Yes, sir.
Myself, like I just would want to introduce myself as Secretary of SGM Healthcare Society now.